as I'm reminded that today is Wednesday, not Tuesday, as I thought earlier. Um, Good evening, everybody. Hopefully, you guys are hoping you had a good week so far. It is 5:30, so we'll go ahead and call in to order this meeting of the board and our quarterly reports. We'll start off by introductions. Name is George Mitchell. I'm the board chair.
Stu May, Board Treasurer.
Eve McGee, Board Secretary.
Sorry, Georgie McNamara, staff.
Debbie Pryor, board member.
Robin Meyer, staff.
Anna Maloney Navarro, staff.
Joe Bink, staff.
JD Bink, staff.
Jillian Braun, staff.
Aaron Underwood, staff.
Tom Holcomb, staff.
Kristen Yates, staff.
Brandon Smiley, staff.
All right. Any other board members or ETOS staff? If not, do we have any guests with us today?
Kelly Logan, job one.
Aaron
Lauren
Martin,
Hall,
job
Southeast. Lauren Hall, Southeast Enterprises.
I think that's everyone. All right, so let's get into our agenda. Let's start off with the presentation. Properties quarterly report that was sent out. Does anyone have any questions for Robin on that particular report? All right. Hearing none, I guess we can move on to Robin. You want to pull up the slide deck for our services quarterly reports? And I guess we'll start off with agency relations, if that is correct.
I don't see Tracy on here yet.
Oh. All right, so we may skip that part and go to Dot.
Transportation. JD, do you want to do it or you want me to do it? So totally up to you, sir.
It doesn't matter to me. If you want to go for it, go for it.
Awesome. I'll take lead. All right. So fourth quarter 2025, a few of our highlights. Dot billing for 2025 reached 790,400, well, almost 790.5 thousand dollars for the year. And that included some record high billings for several different months. So we had some really good numbers come in as it related to our billing. Dot successfully completed about 84.5 thousand one-way trips this past year overall. In our performance objectives, we hit 7 of our 12 goals. Some of those goals that we did not hit related to how we're getting survey information and stuff like that. But for majority of our safety stuff, safety related objectives, we hit those all year long. Dot established a target goal of 90% of uninterrupted transportation service. The industry standard relating to service access is 85%, and we killed that pretty much all year long, ending the year with a total of 89% throughout the entire year. So we really did well in providing that uninterrupted service. The Dot maintenance team established a target of 90% of repairs completed within 3 business days. In 2025, that target was again, 90%, and they hit an average each quarter of 91%. So they did really well on that. And that's something that we made a really high target for that as well. So for them to hit 91% is extremely impressive. And then the last highlight on this slide kind of talks about just the Geotab and how we're using that to improve some of our safety related stuff. So the Geotab system, we have that on all of our fleet, and we're getting that information, collecting all of that data and using it to look at overall performance, operating habits, and just overall operational safety. Next slide, some of our statistics. We placed 39 new passengers on routes this year. Our canceled service rate was 2.2. So just like I said, uninterrupted service was right there at 98%. We did have a total of 18 vehicle accidents, 10 of those which were considered to be avoidable, 8 of those were unavoidable. None of those led to any real injury, major injuries or anything like that. We did have some property that we had to, some property damage that we had to work through, vehicle damage, stuff like that, but no major injuries in any of those incidents. And majority of those were considered to be minor accidents. In 2025, the department implemented Geotab. I kind of discussed that already. So we're really using that information to just continuously get better in what we do day to day. So we'll continue to do that. And then in 2026, we established a few new objectives. And some of those are improving our safe vehicle operations. So collecting that data, streamlining data into our bus software system to get more accurate reporting in a timely manner. We're also tracking technician productivity a lot better than we were doing in the past. And some of that information comes out of that Geotab system as well. We're also including weather-related route cancellations. So some of the information that you see as it relates to cancellation is only for cancellations where it's a planned service day. So if service is canceled for inclement weather for whatever reason, those days are not encompassed in that number. So what we want to do is track in totality, what does our service look like on days where it may be weather related as well as maybe just short staffed for whatever reason. And then the last one is we're really looking into how we get our survey information. On this slide right here, this just celebrates our 2025 Driver of the Year, Mr. Jefferson. And so you guys met him a while ago this summer at our event. So a lot of good things going on at DOT, still working on a lot of things and getting better every day. So we're extremely excited to see the movement and see the momentum that we have going and the impact it's having for those that utilize our service. Questions?
Brandon, thanks for the information. I just had a couple questions based on the report that came out. There was some data that you shared about people on a wait list that you had added to the wait list. How long is the wait list typically? Like how long are we having people on the wait list?
So it really depends on what their need is and the time of day. Where we're really struggling is for individuals that's looking for service around that 9 o'clock a.m. hour. So it really just depends on that. I can get you some better details as I can get with our coordinator who actually does all that tracking and get exact numbers and break it down a little more. But a lot of it is just trying to get people figured out around that. Not everybody wants that sweet spot number, and we just have so many, we don't have enough drivers and vehicles to accommodate everybody's needs. So that's why some people land on that wait list a little longer than others. But as we continue to look at our software solution, we believe that just being more efficient in what we do will help us a lot with trying to move some of those bodies from that wait list as well.
I appreciate that. And then the second question I had on your performance section on your report, there was a goal that you had for 85% for rider time, and you had like 78%.
Yeah.
What prevented you guys from hitting that goal? Was it just, can you speak to that, and as far as what we're doing to kind of correct that for the following quarter?
Yeah, so that goal is really relating to we don't want any of our passengers, if we can help it, if we can do anything different, we don't want anybody to exceed 60 minutes on a vehicle. And so one of the things that we struggle with is not a lot, but we do have a handful of passengers that might be at 63 minutes and right there at that threshold. But what we're looking to try to do again as we utilize software, remember all of our routing right now is being done manually. And so as you know, we'll never do it better than a software solution. And so as we use that system to help us with our routing, we believe that we'll be able to identify where we can create some of those ride times that are a little longer, put them on a different vehicle where there's some options there to where their ride time isn't as long, and just kind of move some people around where it makes a little more sense and shortens that ride time.
Okay. Appreciate that. Thanks.
Yep.
Hey, Brandon, Stu.
Thanks, Stu.
When I look at your accidents report, how does that compare with previous years?
It's about the same. Looking at numbers, there was nothing that stood out on like why there's 18 this year. Last year, I don't recall exactly how many we had. I have the statistics, but I don't have them in front of me. But relating to a lot of these are accidents where it's like a mirror bump. We had something minor like that where there may be something in a parking lot where someone backed into somebody or scraped up against a pillar or something. So all of them aren't like major vehicular accidents, but we're calculating all of them. Anything where there's a loss or damage to property, that's considered to be an accident. And so we just want to make sure we're tracking all of that. But really, no real reason why we have some of this stuff. A lot of it's just driver error, lack of caution by other drivers or motorists. Some of it may be related to, if it's raining or something one day, I don't know, but no real trends on like, is there something that we should be really worried about as far as we're not doing something safe? I think we're operating really safely. I think our drivers do a really good job at taking the job really serious and understanding the importance of it and being alert and aware. And they do pretty well at it, honestly.
We had one day, it was about 2 weeks ago, maybe 3 weeks ago, where our transportation was not running, but all the schools were running. Is there a certain temperature that you guys make a call and say, we're not going to run, it's just not safe?
No, so what we do is our cold weather, our inclement weather policy is we follow the lead of KC Public School District. So if they're releasing early, we're releasing early. If they're not having school or providing service, we're not going to provide. So we try to make it to where it's as simple as possible, and we follow the KC Public Schools. Okay. So if Lee Summit's operating, they may be, but if Kansas City Mo isn't, we're not.
Okay. Thank you.
Yep.
George,
Sorry about my dog barking in the background. She's outside and she's wanting to come in.
George, do we want to go back to agency relations?
Yes. If there's no other questions does anyone have any other questions for Brandon in the dot? All right. Thanks, Brandon. Go eat your dog. Tracy, we can just go back and do that report.
Sure. That's great. Are you hearing an echo?
A slight one, yes.
I don't know. Maybe go on and let me see if I can figure this out. Right.
All right, QA and safety. You can skip ahead. Thank you to Erin for putting this together for us. It looks very nice. Just a few things from QA throughout the year. We added COD, community outreach, and DOT to the satisfaction survey that goes out. We thought we could capture a wider network that way. And then COD had its first annual quality assurance report. So over the last year and few months, we had been doing logging reviews and all the things we've been doing for TCM, we started doing for COD as well. So they had their first annual report, which was glowing numbers. They reviewed and submitted over 1,200 packets to KCRO to get people different services, as well as 131 PFH packets, which is Partnership for Hope Waiver. We processed those, as well as 52 camp scholarships. So those are the summer camp things people can apply for to get some funding to go to summer camp. And then we had 78,000 in SB 40 funding requests, which are those emergency funds that sometimes we have success stories about, or Tom talks about. If somebody needed, was in a hard spot and couldn't pay their rent for the month or something, we help with things like that. And then with the QA side of things, we're for TCM, we're reviewing log notes. So any of our billing, we're checking those to make sure we're meeting all those state, federal, local, and our own internal guidelines for submitting a log note. And they reviewed over 13,000 of those, and 93% had no errors, which means they're basically perfect. They didn't even have a quality recommendation. So that's a really good percentage on those. And then for COD, they did the same thing. Since it's a smaller department, they looked at 605 log notes that were going to be billed, and 98% of those were perfect. And then one other thing that they do is those annual plans that people have. So person-centered support plans, we reviewed those for the support coordinators. And our average throughout the year was a 91%. So we have it set up to score each review a percentage of how well they did. And 91% for the average for the year is pretty good. So next. Then our safety coordinator, some of the projects he worked on throughout the year, plus the former safety coordinator, because we had a change in the middle of the year. We redid all of our evacuation maps and our floor plans, as we found we didn't have floor plans for everything. Like I think DOT shop, maybe we were missing a floor plan. So we got those, we got them updated. He added in lots of things, updated so that they have a Spanish option as well. They have fire extinguishers and all that good stuff on there, which is great. They're more visual, so it's more easily accessible. And then we added, updated the emergency shower and eye wash station and the DOT shop. That's hard to say. There's lots of S's. The old one had just been there forever and was kind of in not great shape. So that got upgraded. As well as we added gas detectors in all locations. We had an incident where we're like, is that natural gas? Not sure. And it's something we didn't have in every location, so we installed those. One of the bigger projects was the safety railing on 8511. So if you go up the 3rd floor and go up the roof hatch, that exit is right on the side of the building. So anytime our staff had to go up there, our contractor, it was kind of risky, especially on a windy day. So we've gotten lots of compliments from contractors on having that available. One other big thing was at DOT, we added in some speed bumps and a mirror to better see with the different buildings there. Drivers couldn't always see someone coming from another direction. So this mirror is pretty large in size and should cover more area than what they had before. And then another project was replacing ceiling tiles. We had lots that had been discolored, or is that a new leak? Is that an old leak? So kind of getting a fresh start on that. We were able to just paint over a lot of them because they were old stains. So they could just be painted and didn't have to be replaced, but just helping the overall look of the buildings. No, I think that's all for me. Any questions?
On your previous slide, there was 78,000 on SB 40. Is that emergency funding?
There's emergency funding. We also, there's a few other smaller categories. Like somebody, if they need dietitian, let's see, blanking on the gym memberships is a big one. People can ask for assistance to get part of a membership or all of a membership. And I think those are kind of the main ones. We have a conference one in there, but I think I've only seen one person request that before. Yeah, thank you.
Thank
All
you.
right, thank you.
All right, so we're gonna roll into TCM highlights. So there's just a couple of facts up here for our annual. We supported on average 1,691 folks this year. I would say towards the last 6 months, we've supported over 1,700 individuals consistently. So that's been a really great number for us. We had, through intake from Kansas City Regional Center and our own COD department, we had supported 182 new individuals throughout the year with that. And then we have field trainers for our training department, and 93% of their time was spent supporting some sort of ETOS staff in multiple departments. So that's really great. And then our due process coordinator, she reviewed over 69 internal due process referrals, which is really great that we're getting that in line, and it's been an objective for us to do better in that area. For 2026, we are going to keep all of our objectives the same. Robin, can you go to the next? So here's just a snippet of those objectives. If you look at my quarterly report, you have a whole annual analysis of all 10 and where we did and where we went up. But for a couple of these, this is about us completing our visits, getting out, seeing the people. We hit 98% for our annual segment. We hit all those visits. Getting our plans out by the first of the month, we hit 92%. And then for transitioning folks, so that 182 I just referenced, those people coming through intake, we have a really quick turnaround that we have to get a plan done, have a meeting, and we hit 78%. That's still better than what we were, but we know that's still an area of improvement. We have a lot of factors into that, like getting a hold of people, or they're very new to services and they don't know what that all means. And so scheduling can be hard, so it's still a target for us. And then from our surveys, asking individuals or best informant, do your support, are they attentive and responsive? And we had 99% for our annual on that from from our surveys. I think that is my only slide. If you guys have any questions.
I have one. There was one goal of finding of waived services entered into the system.
Yes.
What exactly is that metric, and what are we going to do to improve it? Because that's probably the lowest one that we had on the report.
So we did better than 2024. So we have consistently gone up. I will say that. We saw a very drastic increase in our last quarter. We did a pretty extensive training in October, and just going over why it's important, what are our barriers, why are you not entering these apps essentially, and that's what we call them. But when there's an issue and we're not reporting them into the state database is what that is. And so it has gone up and it has stayed up since then. So it's something we're still working on. We are also implementing, a change to how we monitor services. It's not really changes in how people are getting out there and meeting with people and making sure services are still meeting their needs, but we're changing how we're documenting that. And so now that we're adding a new document, we're hoping that will also help catch, because there's going to be 2 areas now where you have the opportunity to be reminded to go and enter that information, and that we can monitor the effectiveness of that.
Okay.
That starts
So-
at the end of this month.
Okay. So then we probably should see next quarter a good upward trend versus the dip we had in the third quarter then.
Mhm.
Okay.
Yeah.
Cool. Thank you.
So COD, we have, at the end of the year, 724 people enrolled in our program. We had intake, our intake comes from TCM, CHS, or KCRO, and we saw an intake number of 162 new individuals to be enrolled in COD this year. Referrals, we do referrals. Those referrals are for anyone who calls ETOS needing information about resources. It comes from KCRO, CHS, or our TCM department. We completed 759 referrals. Those are actually completed. So we were able to contact that person back, respond with them, and provide that resource to them. We get a significant amount of referrals from the community. That might be someone wanting to know, how do I get linked to services, or how do I pay this bill? I don't have the means to do that. And so the team is constantly navigating how do they manage caseloads and the people who are enrolled, and how do we still provide that really quality resource information to anyone who calls. So we did implement some changes, some pretty big changes at the end of the year. We streamlined our enrollment. So that was one of the areas that we were seeing impacted when we were collecting our data, is the timeline it took for us to respond to people who were getting enrolled and getting them connected to a coordinator, a resource coordinator. And so we really looked at streamlining that enrollment process and streamlining how we transfer if we discharge someone. We have a lot of people who are sitting in our program who we're not getting contact back from, who aren't responding to our communication. And so how do we look at making sure that we are still supporting them if they need it, but if they don't, moving them along their journey. And then we also implemented a person-centered support plan for all the people who are being enrolled in the program. It's not as extensive as the one in support coordination, but it is just a way to guide us through helping someone meet specific goals that they might be working on. So our objectives for 2026 are going to be significantly different. Almost all of them were based around survey responses. And so we are changing those. We've kept 3 of them. The 3 that we kept, 2 are survey based, and then 1 of them is regarding Medicaid submissions. All of the rest of them now will be service based. So it's going to be around how the timeline between when someone's getting a referral for Medicaid and when we're getting that Medicaid submitted. We're looking at the time between when someone's enrolled and when they get assigned to a resource coordinator. So everything is going to be really service focused versus focused on the feedback we're getting from people who are in the program. We still are getting that feedback, and QA is doing an awesome job getting surveys out and getting those responses so that it can help us with programming. But I really wanted our focus to be on providing really quality service to all of the people who are enrolled in our program and the people who are potentially interested in being in the program. And then our next slide, similar to support coordination, I gave a snippet of our performance objectives. So the one that I was talking about that we missed was the minimize the amount of time it takes to provide resources to people. A lot of the barrier we had with that was we didn't have a really great tracking system. When you're using email and you're getting, hundreds of emails a day, it gets lost. And so putting that process in place and streamlining all of that has helped increase that number. And I anticipate that we'll be able to meet that goal through this year. But the rest of those there are some of the main ones that are not just survey based that we're touching, like the service that we provide. So any questions?
Okay.
Oh. Are we ready to go into training?
Sounds like it.
Okay, so here's some training highlights. So the 3 areas that we all hit the targets, it was excellent year. Employees receiving their competency-based training, that was 97%, and that's all employees. New employees getting all of their trainings done within their time frame is 99%, and new support coordinators completing all orientation for DMH was 100%. We are keeping the objectives the same, but we are changing the goal of from 90% to 95% of trainings completed on time instead of just completed. So it's just another way to challenge ourselves and continue in that direction, since they're really important for our audits and money-based services. Any questions on training? Thank you.
Nope.
We're gonna try again. Is it muted everywhere? I'm not sure what's happening. I've never had this happen. It was not. Can everybody else mute? Maybe that would help. Is there anybody that's not muted? Maybe if someone else could share. I'm so sorry. Georgie's probably not that person.
Tracy, we can read your slides. We can read your slides. Okay.
Go first.
Provider training. There were 631 people who received their trainings for CPR, first aid, med training, gentle teaching, and IDD and dementia, and that was for the provider trainings. They do have the specialty classes provided this year, which is child CPR and first aid. You can see a long list there of various DD trainings, the system of care. The wrestlers presentation I know was a really big hit and touched a lot of people, and Tracy's really proud of that one. Zach Cowan. There's the mental health, the community employment, financial planning for families, VR trainings. I could just go on, and Leadership Academy by Tammy, which I heard great feedback about also. For agency relations, they funded 22 providers and 40 programs within the organization at nearly 5 million. 1,980 individuals were served during that year. 34 programs were responsible for fulfilling outcomes. 21 met all 3 targets, 9 met 2 of the targets, and 4 met 1 target or less. In total, agencies met 83 targets and did not meet 18 for a result of 82% of targets met. Tracy, I know you probably have so much more you want to say, but if you want to put it in the chat. So, Tracy, if you want to go to the next slide, Robin. Is that the?
That was it.
Okay.
Okay, well, I can actually do that first page if you want, Rob. But I have to get closer to the screen. So you've all seen my budgets. There's lots of numbers on them. In a way, every number that's on the budget is a goal. You know, we want to accomplish the revenue. We want to avoid exceeding the expenses, that kind of thing. But we've picked out these particular measures as things that are keys to managing the operation. So the first one is a measure of profitability of support coordination. We measure the value of both the revenue they generate plus the time they spend on supporting individuals that is not billable, and we subtract the cost of providing that service. Our goal for 2025 was to break even. The actual result was minus $302,000, and our goal for 2026 is to not do worse than 2025. The second goal there is maintaining budget control, and that just means making sure we stay within the approved budget. Since the law requires us to do that, it's a pretty important goal. And we met that by somewhere around $750,000, actually $800,000 in 2025. The 2026 budget is $23.8 million. The next line there is DOT's Medicaid revenue. Our budget was $690,000, so that was the goal. And they whipped up on that goal by $100,000. The budget for 2026 is $750,000, so it's quite a bit more than the 2025 budget was. That next line item is the percentage of our expenses that are administrative. In 2025, our goal was 12.5%. We came in at 11.6%. And so we're going to ratchet the goal to 12% for 2026. And then we've added one more budget related goal to this list for 2026, which is the DOT overtime costs. So that's budgeted at $100,000, and we're going to try to beat that. So those are the budget related performance objectives that we're tracking. Anybody have any questions? Okay.
Right. Hey, do we have any other presentations?
I believe that's all.
All right. Do we have any new business? Or any old business? All right, Robin, did we have any public comments submitted?
No, we did not.
Okay. Hearing none, do I have a motion to adjourn?
I move that we adjourn.
All right, do I have a second?
Second.
All right, all those in favor?
Aye. Aye.
Right. Thank you, everybody. We will see you all next week. Have a good Ash Wednesday.
Thank you.
Bye-bye.